Hi, I am Dr. Nitin Prabhudesai, a practicing ophthalmologist in Kothur, Pune for almost last 25 years. Today, we will be discussing on one of the very common topics for an eye surgeon, that is cataract. What do you mean by cataract? If you look at this model of the eye, if you make an opening, you can see there is a crystalline lens in the eye, and this crystalline lens is used by the eye to focus of the light which falls on the eye from the front on the back part of the eye, that is the retina. So it is common logic that if this clear lens which we have since birth starts getting opaque, then less light would go in the eye and our vision would start getting blurry. So this is what is a cataract. When a clear lens gets opaque, we call it as a cataract. Who can develop a cataract? Anyone can develop a cataract, but the commonest cause of cataract is aging process. Hence, most of us would develop or start developing cataract from the age of 50-55 onwards, and as we grow older, more are the chances of developing a cataract significant enough to consider some form of treatment. Rarely, babies can be born with a cataract, or young children can have some eye infections or eye inflammations and develop cataract. Injury to the eye at any age can develop a cataract, and systemic diseases like diabetes can also produce cataract. Hence, cataract can develop at any age, but as I said earlier, it is more common as an aging problem. So what does one do if he develops a cataract? The permanent treatment for cataract is a surgery. However, the need for surgery depends on every individual's visual needs. So we may have a precision worker like a watchmaker who, even if he loses 10% of the vision because of cataract, may need surgery, or for that matter even a pilot may need surgery earlier. Or on the other hand, a manual worker may not need a cataract surgery immediately. So we have to individualize the patient's need or the person's need to decide the timing of the cataract surgery. What do we do in the cataract surgery? Commonly, what we do is replace this opaque lens in the eye with a clear artificial lens. And the common procedure to do this is called as phacoemulsification. Phacos is a Greek word for cataract. So we remove that cataract, emulsify it with a special handheld ultrasonic probe, and that emulsified matter is then sucked out of the eye, and once the cataract is cleared, we implant an foldable intraocular lens in the eye in the remnant of the cataract bag. So this way the patient recovers vision within few hours of the cataract surgery. Before cataract surgery, we would routinely like to rule out any infection in and around the eye, and to a certain extent in the body also. Systemic diseases like diabetes have to be taken care of before considering cataract surgery. Another important point in cataract surgery which is discussed commonly is a type of lens. Usually the lens which is implanted in the eye nowadays is made of a material called acrylic, and most of the time most surgeons would prefer to use a foldable lens in the eye because it can be implanted through a very small opening in the eye. Also, there are lenses, the types of lenses where we call it a unifocal lens or a multifocal lens, and there is also a lens called a toric lens. So what does these lenses mean? Basically, a unifocal lens is to clear your vision for distance, and you may need to wear a reading glass after the surgery. Whereas a multifocal lens is designed with different refractive indexes, so you can use the same lens to look at distance, intermediate and near vision. And the toric lens is designed to correct what is called as an astigmatism along with the spherical power. Actually, it is the doctor who decides after discussing with you the type of work you are doing, and based on that he advises you what the type of lens is preferable for a particular person. Also, there is a question of economics because certain types of lenses may be very costly. After the cataract surgery, most of the time these surgeries are done under local anesthesia or topical anesthesia. The recovery is quite fast. Within a few days the patient recovers his good vision, and he may have to use drops, either the anti-inflammatory drops and certain antibiotic drops along with lubricant drops for about 3 to 4 weeks. After a period of a few days, the patient is able to perform his routine activities along with washing of face and taking head bath. All those things are possible. Nowadays we don't have to avoid looking at the light or going in the kitchen. Most of these activities can be done within a few days of the surgery. Once the surgery is performed, the doctor may watch the patient for the first 1 month. He may check his retina and confirm that everything in the eye is fine, and then the patient is sort of tapered off all the medications and is back to his normal life. Hence, I feel in the modern day, cataract surgery is quite predictable, and the modern technology has made it very safe also. Thank you.